Joining me now, Dr. Francis Collins, head of the National Institutes of Health. Dr. Collins, good to see you. Thank you so much for being on the program. You got your vaccine this morning. We saw it live on television. How was it? How do you feel?
I feel just fine. I'm not even sore. It was easy administration, and I'm delighted to have been able to be part of that this morning, along with Tony Fauci and Secretary Azar and a bunch of healthcare workers at our hospital here at NIH, the clinical center, who are taking care of patients with COVID. We just wanted to make this a special day because the Moderna vaccine, which is the one that we received, was actually started at NIH, right here where I am, as a design process that kicked in immediately after we learned about this virus coming out of Wuhan, and which led then just 11 months later to our being able to see this vaccine going into people's arms, including right now mine. So we're thrilled to have reached this point, even as we're really troubled about what's happening in our country, and we need to get those vaccines out there as fast as we can.
Well, let's talk about getting those vaccines out quickly. For example, what we just heard from Ellison Barber about the snafu. They were expecting thousands of doses. They didn't get them. We have heard state after state, people who have said, well, we thought we were getting this many, but we got fewer. That has been acknowledged by the administration. But overall, are you concerned about the early phases of this rollout? Could it have gone more smoothly, or is what you're seeing to have been expected, do you think? Some of the problems. When
you consider millions of doses needing to be shipped out within 24 hours after an emergency use authorization by FDA, I'm astounded we've not had more glitches than we have. And General Gus Perna, who's the person overseeing this for Operation Warp Speed, is a very experienced materials management guy. And yeah, I'm sorry Springfield had to wait an extra day, but they got their 7,000 doses from what I heard. So everybody just take a breath here. This is working out actually pretty well, considering what the logistical challenges are on such short notice. And if we hadn't done what we did with Warp Speed to manufacture all these doses, even before we knew the vaccines were going to be safe and effective, then everybody would be waiting for months to get their immunization. So let's look on the positive side. There's a lot about this that's just downright amazing.
Well, there is a positive side, too, that there are millions of Americans who are waiting and hoping to get the vaccine. But to the point of getting the vaccine publicly, you have acknowledged you're probably not the best person to convince reluctant blacks to get the vaccine. And now Reuters is reporting that key black leaders, particularly pastors, are hesitant to recommend the vaccine, including A.R. Bernard, who's the head of the largest church in New York. He turned down a request to be part of a group to convince blacks to get the shot. Here's what Reuters wrote. He worried some members of his congregation could view his participation as joining forces with the system to use African Americans as guinea pigs for vaccines that have been developed in record time. So how is NIH and other facets of the government addressing this trust gap right now?
And it is a really serious trust gap, and we're doing everything we can to try to enlist the voices of those who are trusted by those communities, especially African Americans, because, yeah, just hearing it from me is probably not going to do it. I hope people notice. In fact, one of the first people to get the vaccine was the Surgeon General, who's an African American and a wonderfully dedicated public servant. I hope they've also noticed that more and more leaders from places like the National Urban League and some of the black churches are stepping forward to say this is something for us. By stepping back, we're depriving ourselves of an opportunity to get past this terrible epidemic that has claimed way too many lives, especially in the African American community. Yes, there's a bad history here from things like Tuskegee, but this is now and that was then. And this is a chance, I think, for every community to be able to have a benefit from this to save lives. And I hope that more and more leaders will begin to see it that way, but they're probably not going to take it from me. Again, we need those voices out in the community of church leaders, of doctors, like the National Medical Association, who are willing to stand up and say, hey, people, this is for us too.
But if they're saying no in the way that I think it was close to a dozen major black church leaders that were spoken to by Reuters, if they still have these concerns, do you have an ongoing conversation? Do you have an ongoing problem to engage members of those communities that frankly are skeptical and remain skeptical?
Yes, we do. And we've been certainly organizing a whole host of outreach efforts. Town hall meeting last Friday night on CNN, reaching out specifically to African Americans and bringing in church leaders as well as scientists and physicians. It's an ongoing effort. I would just hope and pray that those who are skeptical would keep their minds open to the fact that there's information now that can perhaps counter what might be those concerns, those rumors. There's crazy conspiracies out there. The facts of the matter, if people are able to look at them and have that closely examined, are that these vaccines are going to save lives. They're safe, they're effective, they're the kind of thing you want for your family, regardless of your skin color. That's what the evidence would support. I know there's a lot of history here, and I'm not trying to say that that's not a hard thing to overcome, but I think it can be overcome if we just keep talking to each other, and especially if there are trusted voices involved in that conversation.
So let me ask you about the new mutation in the UK. There are now 120 countries that have a requirement that there has to be testing before anybody can come in from the UK. Governor Cuomo was very unhappy that we're not limiting travel into JFK. He's basically said, look, didn't we learn back in March, January, February, March, that we needed to shut this down right away? And in fact, he has convinced 3 airlines to voluntarily test before their flights coming in from London. But is this something that you think should be ruled out? Is there an ongoing conversation about perhaps whether that should happen? Or is it a case of you think the toothpaste is already out of the tube, it's probably here, and there isn't much we can do about it?
A number of things. First of all, we really don't know what the story is with this new mutant version. It looks as if it's more contagious. It spreads more readily from person to person. There's no evidence, though, that it's more severe if you get infected with this. It just may be better at passing itself along. This is not the first time that's happened. The original strain that came out of Wuhan has been totally replaced across the world now by a different one that happened pretty quickly back in the spring. And probably we didn't know as much then as we do now. So now we're seeing another example of that sort. I don't think this is a reason for people to panic at all. I would say it's probably a good idea for anybody getting on an airplane to get tested before they go somewhere. So let's try to say that's an important thing to begin to pay attention to, whether or not there's some new strain around. I would be very surprised if this UK strain is not somewhere in the US at this point, because they've seen it as far back as September, and we have a lot of people going back and forth. But again, we expect this. RNA viruses change their particular RNA sequence all the time. It's sort of how they operate. So we should study it carefully. We are, but I would not think at this point there's any reason to do anything drastic.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.